All right, this is Achilles strap two-way. So you're going to grab this strap for the patient. There's also a darker green strap that you can use as well. And then you're going to loop it around their foot. It's going to be just right here at the ball of their foot. You can also slide this around their foot if it helps it stay on better for them. And then they're just going to pull back until they feel a good stretch. Usually it's in their upper calf. They're going to hold this for 30 seconds, rest, and then do that again. So it's 3 times 30 seconds. And then the second way is they're going to relax and then bend their knee up and then pull, and that gets their lower calf muscle. And right, so this is the plantar fascia towel stretch. So you're going to grab one of the big towels for the patient, and then with their affected limb, so say it's my left limb, so you're gonna have them tuck the towel under their calf to hold it in place. Then you'll hand the end of the towel for them so they don't have to reach over like I'm doing. And then you want to make sure that their shoe is off, otherwise they can't do this stretch correctly. So then you're gonna have them grip the towel and pull it back, making sure to bend their big toe back. So without the towel, it kind of look like this. And pulling back, and that makes sure to stretch the bottom of the foot. All right, this is the standing plantar fascia stretch. So what you're gonna do is you're gonna put the injured leg, the one you're wanting to stretch, up against the wall like this, making sure that that toe can bend forward just a little bit. And then they're going to lean forward into that, making sure that that toe bends as well. All right, this is the heel core board, or on our charts we often write HCB. So you're gonna have them put their injured leg up onto the board. So say my left leg is injured, I'm gonna put it right here. You want their heel just near the bottom of the board, kind of close to the floor. If it hurts for them to stand on it, you can have them support their weight with their other leg as they lean forward for the stretch. If not, they can just do normal. So first they're going to lean forward like this for a stretch, and they're going to do this one 3 by 30 seconds. Once they're done with this one, they're going to come out of the stretch, bend their knee, and lean forward. Often patients have questions about where they should feel these stretches. With this one, they're going to feel it through their calf, especially that upper calf usually. With the bent knee one, it's common for them to feel it in 3 places. Their lower calf, which is where this stretch is like technically designed to stretch. They can also feel it in their upper calf if their calves are really tight, and they can feel it in the front of their ankle. All of those are normal. We also have a timer right here that we use to time for 3 by 30 seconds. Make sure you tell them that it falls off easily, because often they'll go and press the button and then the timer falls down.
Okay, this is called single leg stands. On the charts, it will be SLS. And the basic way to do it is you just have them stand on their affected leg 3 times for 30 seconds. You can have them kind of by a counter so that if they lose their balance, they have something to grab onto and they won't fall over. If that's too easy for them, we can make it harder by having them stand on this foam pad. Again, you can have them over by a counter or something to hold on to. And if that's too easy, then you can play catch with them 3 times for 30 seconds, have them stand on the foam, and then toss the ball back and forth. For this exercise, you want to make sure that they know to grab onto a counter or something so that they don't fall over. And if they are at risk of falling, then you want to be with them, just making sure that they're not gonna fall. All right, this is the T-band, and there are 2 different ways to do it. The therapist will write on the chart which way he wants to do. There's 2-way and 4-way. So 2-way, you'll put it around their foot. So this is the first way. And then you'll explain to them to have them pump back and forth like this. If their shoe is making it harder for them to move, you can have them remove their shoe, and you do 3 sets of 15. And then the other direction for 2-way is this way. You can have them hold the band and then have them pump back and forth again like this. For 4-way, you'll do both those directions, and then you'll also add side to side. So you'll hold it and have them go that way. When they're going side to side, you want to make sure that they're not moving their whole leg like this. If they're having trouble with it, you can kind of hold their knee, because we want this to be an ankle exercise. And then same thing this way. You'll hold it and you'll make sure that they're just moving the ankle and not rotating the whole leg like that. When you're doing 4-way, you'll do 2 sets of 15, just because they're doing so many different directions.
So this is slocums, another common exercise. So this is what the setup looks like. Weight, if they're using weight, you want to fold the towel in thirds and have it laying like this. Give them a cane and the spray bottle. So you're going to have them sit down. The spray bottle is so if they're doing it, especially with their shoe off, they can spray the towel down and it helps them grip it better with their toes. They just scooch their foot sideways like this. You don't want them moving their foot. You want it to just be an ankle movement, so their knee is going to stay still. The sets for this are 3 by 15. Each motion of the ankle is 1, so I'd be like 1, 2, 3. They do both directions, so after they do 3 sets of 15 this way, they can use the cane to turn it around and do it this way. And again, just make sure that knee stays still, and it's 1, 2. All right, so this is towel crunches. You want to make sure that you give the patient a cane, the spray bottle, so they can spray it down and help their toes grip the towel a little bit better, and weight if their chart specifies weight. If they've just been doing slocums, then you can use the same long towel like I've got here. If not, you can use one of the smaller towels and just have it folded long, hot dog style, and you'll put the weight at the end if they're using it. So for this one, they're going to put their heel just right here and put their toes on the towel, and it's just like a little toe crunch. So like this. Are going to do 3 sets of 15, so each crunch is 1, so I'd count it like this, 1, 2, 3, etc. One thing they'll commonly ask is once it gets really scrunched up like this, it can be hard to do it anymore. They can scooch the towel back, rest their heel in a new spot, and continue scrunching. We want to make sure when they're doing this that they're not using their leg to move it. We want it to be just a movement of the toes.
All right, this is called marble pickups. We have a cup full of marbles that we keep over by the aid counter. And what we'll do is we'll pour them out on the ground for the patient. And then they pick up the marbles with their toes and put them in the cup. And they'll do this 3 times. And one thing that is important is to clean off the marbles after every use and get a new cup.
All right, so this is step throughs, and I'm also going to be showing weight shifting. So step throughs is going to be for 3 minutes. You'll just give them a timer and they'll do it the whole time. So say my right leg is the affected leg. I'm going to start on my left, and I'm just going to go ahead and take a nice, even, controlled step, making sure to go all the way through to the toe roll off and then going back.
Show me one more time.
Just like this. So heel, toe, lift up, toe, heel, lift up. So we'll do forward weight shifting as well as lateral weight shifting. So for forward weight shifting, again, saying my right leg is the injured leg, I'm going to start on my left, and we do it here by counter for support if the patient needs it, as well as for balance. And they're just going to slowly shift on to their foot, getting as much weight as they can support, and then they're going to hold that for just a moment and then shift off. And they don't need to go all the way on. At that point, we'd be having them do a different exercise. For lateral weight shifting, they're going to be facing the counter and saying my left leg is injured this time. I'm going to start with my weight on my right like this. I'm just going to slowly lean onto it, getting weight. Leaning farther onto the counter can be helpful, especially for patients who are a lot weaker.
All right, this is the BAPS board that we use for ankle injuries. These are the different levels, starting with 1 going down to 5, and it will be written on the chart what level the patient is doing. So you'll take the level off, and then you'll screw it onto the board, and make sure that you're putting it on the right side. For example, if I'm working on my left foot, you'll put it on the opposite side, and vice versa. So you make sure that's screwed in, and then you'll have the patient sitting in a chair with their foot on the board and their knee at a 90-degree angle. And then you'll make sure they have a timer set for 1 minute, and then you'll have them go clockwise, nice and controlled. They don't have to go fast, but just trying to get all sides of the board down as they go around. And they'll do it for a minute twice, and then they'll also go counterclockwise twice for 1 minute. And sometimes the therapist will also want them to do a version where they're tapping, where they'll just go back and forth like this for 30 seconds and side to side for 30 seconds. All right, some common mistakes with this one is they'll move the whole leg with it, but we want to make sure that they're keeping the knee in the right place and keeping it from moving and just using the ankle to move the board. And we also want to make sure that they're not sliding the whole board around and that their knee isn't at a 90-degree angle. We want it at the 90-degree angle and nice and controlled throughout all the movements.
All right, so this is ankle isometrics. So there are 4 different directions that we do for this one, and for each direction, you're going to do it 10 times for 10 seconds. So I'll go through the directions. So let's say my right ankle is the injured one. Be sitting down, and for plantar flexion, you're going to have them point their foot like this, and they're going to be resisting with their hand. So there's going to be no movement, but they are resisting. There's also dorsiflexion, which is bringing the foot up. So I'm going to place my hand on the other side of my foot, and I'm trying to push my foot up, but there's no actual movement. So we're going to hold that 10 times for 10 seconds. Then there's inversion, which is this type of movement. And I'll place my hand here, trying to press that foot up and in, again holding for 10 seconds, 10 times. And then there's eversion, which is splaying the foot out like that. And then I'll resist down here and try and push there. So one thing you can teach them to do is, instead of doing all of these ones and then all of these ones and etc., you can have them alternate. So do one of these, one, and then go through that way.